Pelvic floor physiotherapy is about improving comfort, confidence, and quality of life. Even if you're unsure, coming in for an assessment can give you clarity and options. And if we discover your pelvic floor isn't the issue, we might find a root cause elsewhere. I'm Jenna, I'm the physiotherapist here at Health Within, and I've recently completed my training in pelvic floor physiotherapy. So this allows me to assess and treat a wide range of pelvic health conditions and concerns that people might have. And it helps look at both external and internal work and just working with the patient to get them feeling their best. It's actually quite a common thing that a lot of people think that leaking is normal. How many times have you gone to a party and you hear someone say, "Oh, don't make me laugh, like I need to cross my legs, you're gonna make me pee." It's so common and so many people talk about it. But the thing is, just because it's common doesn't necessarily mean it's normal. It typically tells us that if you do have bladder leakage, there is a pelvic floor dysfunction, and it typically means your pelvic floor muscles aren't strong enough to support and to hold it. But because so many people have it and so many people talk about it, a lot of people just think, oh, it's normal, like everyone has it, it's not a big deal. But it is treatable. The pelvic floor is made up of a group of muscles called the levator ani, and this is 3 different muscles. So what they do, they sit at the bottom of your pelvis and kind of act like a hammock or a sling. This hammock supports your bladder, your bowel, and in women, your uterus, helping keep everything lifted and up in place. These muscles kind of work like a flexible trampoline. They can tighten, lift, relax, and stretch depending what your body needs. So basically, if you have leakage, it typically tells me that there is weakness in the pelvic floor muscles. We look at working at strengthening those, getting them to work with the rest of our body at the same time, so that whenever we do activities, our pelvic floor muscles can fire, and they can fire at the appropriate time to stop that bladder leakage. The biggest thing I want people to know if they're dealing with bladder leakage or pelvic pain is just that they're not alone, and it's not something you're stuck with. You can always do something to help. Reaching out to a physiotherapist or someone who has pelvic floor training can help kind of figure out what the root cause is and help figure out how we can fix it. It is a thing that men and women both need pelvic floor physiotherapy because they all have a pelvic floor. I find it's more talked about in women, but I want it to get out there that it is approachable in men as well, and it is a thing and it can be treated.